Everyone, it is 4:01 and I want to start out by saying thank you to everyone who has joined us today. I see a number of people here on the Zoom meeting, so that makes me very excited because you guys are going to get a lot out of this topic today. So we'll go ahead and jump right into it. Next slide. Alrighty, so we're just going to touch on some housekeeping things to start out with. Please make sure your microphones are muted. We are going to have a robust question and answer session at the very end. We do encourage everyone to turn your cameras on during this event because it's going to be very interactive. We want to hear the questions that you have, those kinds of burning questions that you've always wanted to ask to help you be better during an interview. For any kinds of questions that you have during the presentation, please put them into the chat box, and we will make sure to circle back and make sure those are answered for you. We will have a post-webinar survey that will be sent out tomorrow, and we would deeply appreciate it if you were to fill that out and submit that back to us so we can see how we're doing and how to improve for future. Next slide, please. I want to review our mission for our organization, the National Hispanic Pharmacists Association, which is to empower Hispanic pharmacists and other members to improve the health of Hispanic populations in collaboration with the public and private sector partners. Our vision is really to be the lead pharmacy organization for improving the health of Hispanic populations in the United States. So I thank you guys for also aligning with our mission and vision and being a part of this organization. Next slide. We want to thank our board of directors who have put in a tremendous amount of time and effort to see our organization through from its very beginning to where it's been now. Next slide. We also really want to thank our corporate advisory committee members. Without their support, our organization wouldn't exist, and our fight to improve the healthcare of Hispanic population really would not be on the forefront and one of our goals. So thank you to all of these individuals. Next slide. We also want to thank our NHPA student chapters. We started with 0 student chapters, and look at how much we've grown. So if there's anyone on this webinar today that is not part of one of these universities or schools and is interested in becoming a student chapter, definitely reach out to us and we'd be happy to chat with you and help you organize this at your school. Next slide. Alrighty, so without further ado, my name is Lisa Marie Serrano. I am a board member for the National Hispanic Pharmacists Association. I help to run the programs committee. So part of that is being able to give you education, the students, as well as our pharmacists. So today's presentation is going to be about career interview preparation. And we have phenomenal speakers today, which I'm not going to introduce them, but that is Dr. Medina as well as Dr. Cortez. They are going to give you an idea as to where they've been in their journey through pharmacy and what makes them experts in interviewing and giving you these tips for interview skills. As for myself, I've interviewed hundreds of individuals at all levels, from students to technicians to residents to pharmacists to directors of pharmacy. So we are here to give you those tips and tricks. Next slide. Okay, I will hand it off to Dr. Cortez.
Thank you, Lisa, and thank you for NHPA for hosting and having me here today. It's always great to communicate this information with the students. So a little bit about myself. My name is Christina Cortez, and I am a clinical assistant professor at the University of Illinois College of Pharmacy. I am also the 340B compliance coordinator at UI Health Ambulatory Care Pharmacy Services. Next slide, please. So I'm going to give you my snapshot. I've been on both sides very recently. So this hits very close to home. I've been on the interviewee side, and I've also been on the interviewer side. So I can share my perspectives, but this is my journey. I graduated from UIC College of Pharmacy in 2011. I personally did not decide to pursue a residency. I went on to practice at UI Health as a float pharmacist, and also stayed on with 2 jobs at a big box retail pharmacy as a PRN. I did that for about 5 years. I gained experience, established, build my communication skills with my patients, and then it really opened up my eyes to what I really wanted to become in the future. I then later went on to, within UI Health, I became a staff pharmacist at our federally qualified health center. It was one of my missions to definitely share and connect with the patients, establish that patient connection and relationship that I did not have as a float pharmacist. Also being the FQHC and me being bilingual, a lot of the patients there spoke Spanish, and I was able to help my patients with the language barrier and health literacy barrier that they incurred. I wanted to grow as a professional, and I want to explore different opportunities. I did see other opportunities come immediately in front of me. However, I was not prepared. They did not, they required actually a BCPS certification. So after investigating and learning that you can sit to be board certified after practicing 3 years in your particular area, I decided to apply and sit for the exam, and I passed. I was very excited. That was a huge milestone for me, and it definitely opened up another series of doors. I did not want the doors to be closed. I wanted more opportunities. Then come around in 2021, there was a position within my department to grow. And now I've had like a career change because I'm no longer on the, as an end user, patient facing. I'm more in behind the scenes. I'm a 340B compliance coordinator. So I will be happy to share my experiences later with you all during Q&A, the questions that you may have. Next slide, please. So I'm going to break up my topic discussion into 3 buckets. We have tips and tricks, fatal flaws, and just the global view. Next slide, please. So as far as tips and tricks, as we know where we are in the pandemic right now, most of the interviews are either phone or video. Hopefully soon we'll be going in person. But those are the type of platforms that types of interviews you will have. Typically, most interviews will start off with a phone interview. And then after, if you pass that first phase of the phone interview, it's typically with HR. There's certain series of questions. They evaluate those responses. Then you're typically invited for an in-person or video type of interview. Agenda is very important. No matter what position you're applying for, whether it be staff, whether it be director, it's very complex when interviews are scheduled. There's a lot of people involved in the planning process. As the person that's being interviewed, you're just one person. But from the institution side, there's many layers and many schedules that we need to work with. So please ensure to be flexible as your schedule permits, but also be mindful and keep current with your email as schedules may change and the agenda may change. It may look similar. Use the most updated agenda because people may be swapping in and out of the sessions, okay? And it's also good to know where you're going to be, what's coming up next for the day. When you receive this agenda too, don't think because it's a smaller interview, like if it's only an hour, it's not as important as an interview that lasts all day. I've seen where a staff pharmacist position will be interviewed for an hour and they'll be interviewed by 3 candidates. and then by 3 different employees. However, there could be the opposite spectrum where you can have a half a day full of interview and where you're meeting with multiple personnel, and you may even have to do a presentation. And when you're looking at it as the person that's being interviewed, the title may be the same, and it is the same, but it's a different institution. There's different departments. It depends on how large the department is, how large the institution is. So don't judge the agenda by necessarily like whether you're going to like the job or not. Next slide, please. So along with tips and tricks, I know it's very hard, but make eye contact. And you want to emit that energy. You want to smile. If it's a phone interview, if you're not smiling, for some reason it comes across that you're not smiling as well. I'm sure we've all been in that position where you call a customer service line and you feel that someone's not having a great day. Well, clearly, if you have a smile, it emits a different type of energy to the person that's receiving the message. So definitely smile while you're speaking, and then speak clearly with good pace and tone. Right now, for example, we're on video, internet. So internet may break up. If you're talking too fast, then maybe some people may not be able to catch your answer. Also, I understand that it's very difficult sometimes to get the cues, the verbal body language that you met that's missing. So that's why it's important to speak clearly, good pace and good tone, where if you need to be interrupted by somebody, you can be if they need to ask a question. As far as research, this is very important and it stands out when it's not done. Please do your research. You want to find out, what is that institution about? How many beds is the hospital? How many pharmacists do they employ? Find out if you receive the agenda, as I mentioned in the previous slide, who's interviewing you? Have they published anything? Is there commonality between you and the site that you're going to? And it's always great to find out those things, because you can, again, if you would like this potential site, and also you have questions. It helps you ask those questions at the interview for the people that are interviewing you. Also, practice makes perfect. I know we're all on time constraints. We're running from one event to another, one Zoom call to the next, but it's important to practice. There are different platforms out there. There's Soapbox, there's Adobe Connect, there's Zoom. Just make sure you run a test run with the platform. What I've done in the past is I download the app on my phone, and then I try it with my laptop, and then I'll be in 2 different rooms just to see if it works. And then also, if it's possible for you to record yourself with a practice interview with questions, practice your responses for common questions that you have prepared for. Also, practice that elevator speech, that first impression that you're going to leave your potential employer with. Also, location. You want to designate a quiet spot that you're going to be able to focus. You're going to have minimal distractions during the interview. So it's important to have that set up before you actually have the interview, if you're going to be doing it via video. Next slide, please. So what are some fatal flaws? I alluded to it in the previous slide, is not researching the employer, not knowing what their mission is, not knowing about their clinics, or not knowing the services that they offer. You're not going to be an expert because you're not employed by them. Clearly, that's why you're interviewing. But if you don't show the initiative to do that, then it also shows lack of interest. Also, dressing the part. Now with Zoom, it feels like we can get a little bit more lax, more comfortable. Please do not make that fatal mistake. Please brush your hair. Make sure you dress appropriately, dress the part, because it is a first impression. Also, what I have seen is ensuring that your CV contains accurate and truthful statements. A lot of the questions that you will be asked during your interview may stem from what's contained in your CV. For example, if you say you speak Spanish, make sure you speak Spanish, because you may well as be interviewed by a fellow colleague, potential coworker in Spanish. And this has happened to me too. You're ready for an English interview and all of a sudden it's in Spanish because the patient population is in Spanish and your CV says you're fluent, you can read, you can write, and you can speak it. So you will be put to the test. Don't put yourself in that situation if you are not fluent, or whether it's in Spanish or another language or in another skill set. Don't put anything that is not truthful in your CV. It shows the integrity of your person. Also know your CV. Again, I can't stress that enough. They're going to ask you about special projects or posters or publications that you've had, or potential employment sites that you've mentioned it in your CV. Also, don't confuse confidence with arrogance. It is important to be confident, but it's also important to be humble and to know that you are a teachable, coachable person. If you come off as you know it all, it shows that you possibly may not be a team player. It's great to have confidence in yourself. Just be careful on how there's a fine line between arrogance and confidence. And overall, don't be late. Don't be late. Always be there early. On Zoom, I know sometimes they may not log on as early, maybe a good like 5 minutes before, but just be ready to test your video platform if you were going to be doing it via Skype, Zoom, to make sure you don't have any technical issues. Next slide, please. So I call it a global approach. Even though you are being called in for an interview, you need to look at it, is this a good decision for myself? So it's a two-way street. They're going to ask a lot of questions of you, but then you need to have some questions too to help you make that decision. Is this the good fit for me? Would I like working for this potential site? Can you envision yourself here? What is the hiring team looking for? And what are you looking for? Is there opportunity for growth, to get involved in other committees? What do they do for their employees for you to grow as a clinician, or whatever your desire is, whether it be clinical, administrative, teaching? What opportunities are there for you too? So with that, we can go to the next slide. Some common questions that I feel are a little bit, I find them difficult. As I mentioned before, is tell me about yourself. Make sure you have this one, knock it down out of the park. Tell me about yourself. You are your best advocate. I used to tend to be shy in the beginning. I've gone through a series of interviews, and then you need to open up. If you've done community service, talk about it. If there's a way that can be used for as a bonus or as a plus for that particular interview, mention it, highlight it. Another question that comes up is, tell me a time when you had a difficult blank and how did you resolve it? We've all had these scenarios in our life. I call it also a curveball, because you can, one, it may trigger emotion because you get a flashback of that difficult time. And then you may lose sight of the question, and it takes to turn to talk about something negative about your previous employer. So don't use that question that way. Use this question to see how you've overcome those challenges and to showcase your skills and bringing a negative situation into a positive. Practice this question. A lot of people get stuck on it and say, can I come back to that question? But it's really not that difficult. I think what's difficult is when you think of it, the difficult situation, the situation comes to mind and you put your emotion to it instead of actually just state the facts and how you resolve the issue. And then another curveball question is they may ask you questions unrelated to the profession. For example, if you were a character from this particular movie, who would you be? So not everything's going to be necessarily pharmacy related or teamwork related. You may get this curveball question and you're like, well, why am I getting this question? This question is stemming from, are you a quick thinker? Are you analyzing? And then, yeah, just to get to know you a little bit better. And with that, we can go to the next slide. These are some resources. ASHP has a really nice grid of do's and don'ts, best practices. I really recommend that. That's that second link. And then US News also had a nice article about how to sound nice on the phone. That's it. Dr. Medina.
Thank you, Dr. Carrizales. That was such a wonderful presentation. And thank you, Lisa, for the introduction. And thank you, NHPA, for this opportunity. Just before I start, a little bit about myself. My name is Dr. Amilda Medina. I am a new grad from the University of Houston College of Pharmacy. I graduated this past May. I had a very interesting first couple of months in my career. I applied for residency, my P4 year, and unfortunately I didn't match in either of the phases. After graduation, I interviewed for jobs and I ended up getting a job at CVS and part of the City of Houston epidemiology team for the COVID unit. After that, then I became involved in many different organizations, joined the TSHP Transitions of Force Task Force and our local chapter New Practitioner Mentor. And now currently going to be one of the next HSPL residents at Novan Health in North Carolina this upcoming June. So moving on for the next slide. In this presentation, I just want to talk about how to differentiate yourself during the interview. And I'm going to close out with just when the unexpected happens, what can you do as you move forward? Okay, next slide, please. So in a Forbes article about job statistics, the average number of people who apply for a job, it's roughly around 118. From that pool, only 20% will move on and go to the interview. And after that, only 1 or 2 might get the position, depending on how many they are. So that's pretty much 23 to 24 people that you're competing with for that position. That's really a lot now. Then the question then becomes, how do you differentiate yourself from the pool? How do you let the employers know that they have found their Waldo from all this pool of many different wonderful applicants? The answer is very simple, you have to differentiate yourself. Next slide. The first step in differentiating yourself starts with the application process. Believe it or not, this is your first meeting, even though you're not there physically, but that's the first meeting that you will have with your potential employer. Depending on how well you prepare these documents, your employer will already have an impression of you. Remember, it only takes 3 seconds to make a good, bad, or good or bad first impression. And it's very important that you make a good impression in this step. Tips that I have with creating these documents, especially with your CB, the order is going to be important. If there's something that you want to highlight in your CB, just ensure that you place it earlier in the CB, and you can leave things that are more common that a lot of people have in common towards the end. Always make sure that you're looking at both all grammar errors that you possibly identify, make sure to fix them and keep formatting the same. In addition, another important part of the application process will be the reference letters. This is going to be very important as well. So make sure when you're asking those letter writers, say something like, hi, I'm applying to so-and-so, and would you be able to write me a supporting, a grade, a positive letter of recommendation. Saying those 3 keywords, supporting, grade, or positive, is going to be very important because you want them to say yes. Because if they say yes, then it means that they're going to be able to speak to the best of your abilities to that program or to that job or to that employer. And you don't want it to be no, because a bad letter of recommendation, unfortunately, can be a big factor of not moving on in the process. Next slide. Okay, so we differentiated ourselves in the application, and now we're in the interview. So it's really big congratulations. This is a very big accomplishment. Take that time to be excited and be happy that you made it to the next phase. And then now that you're in this next phase, the next thing that you need to do to differentiate yourself is to connect the dots. It's going to be very important that when you're answering these questions that you let the employer know that you're the perfect fit for that position. Describe how your skills and your experiences will be beneficial for whatever role that they are needing for, and how you're going to be able to help meet that need and possibly even do something more. A big tip that I always have when answering questions is to use the SMART format. And when you're using those stories for your SMART format, make sure that they can be related to the employer and their needs. If you have unique experiences too, that's a great way to start off the interview. You can mention all those great things that you have done, and it's okay to brag yourself a little bit during this time to make it memorable for them. For me, one of the things that I did was that I did a mission trip in Costa Rica in undergrad, and I remember I would mention that, and they would know me as the Costa Rica girl whenever life happens and I met with them again in the future. And I just did it because it's something I'm proud of, but I didn't expect that they would remember such little details, but it's true. Then I talked a little bit about like connecting the dots, and it's something very important. Dr. Carrizales mentioned in her presentation. To do this, it's your research is going to be very important. Be able to research the company, be able to research the employers, your position. And when you get that agenda, sometimes there's names of whoever will be involved in the process. Take that time to research them as well. Maybe you'll find out a research article that they wrote about at something that's in your interest, and you can talk about that during the interview and make that connection and show how really interested you are in that position. Also, you can ask questions and anything that they have done that you might be interested about. It's always a great time to get to know them, and you never know what might happen in the future. You might not get the position, or you might meet them down the line in your career, and having that connection had made, and it might come very handy down the line. Next slide. Okay, and then the last tip will be to simply be yourself. Like the quote in this picture says, "Be yourself, and original is worth more than a copy." That's something that's very true. Throughout my time I've had interviewing, my best interviews were the ones where I was really myself and trying not to fit that perfect picture. I think that's something that happens to everyone. We start getting into like, how do I need to be? What's the perfect? How can I change to meet that criteria? But it's always important to stay true to yourself and remember who you are. And if the fit is there, then it would happen. Next slide. So just remember, in this pool of candidates, differentiating yourself is going to be very important. It will allow you to become very memorable and increase your chances of securing a spot and have them find that Waldo, like how I search it up in the picture right here. Okay, next slide. So just to end real quick before we move on to the Q&A, I just want to talk a little bit about goals and what to do when the unexpected happens. Next slide. So unfortunately, there might be that time where you didn't get the opportunity. It's okay. It's part of life, and what's important is that you gave it a try. It might not have been the outcome that you wanted, but it's something that you put yourself out to, and it's something that now you'll know down the line, like maybe I should have tried this, and I didn't, but you did. So you have that experience. The first thing that you want to do will be thank the team for the opportunity of the interview. The world is very small, and as you might have heard, pharmacy is even smaller. So you never know if you're going to see them or cross paths again. So it's very important to show your gratitude and not burn any bridges. Reach out to the interviewers, ask for feedback. Maybe there was something that they noticed that you can improve for next time, or for if you're applying for other positions. Always keep your CV active. Never leave that out of date. You never know when a new position might open, and having one ready to go is going to be very important. Reach out to your resources. That's something that I did when I didn't match the first time. I reached out to my network, I reached out to my friends, and worked on all the areas I needed to work on. And this year, I'm able to say that I matched the second time around. And reflect, just reflect on what's this experience and come up with a game plan. This is also time to ask you, is this really what I want for my career? Is this something that I really wanted for myself? Is there something else that maybe I should try instead? Figure out the answers to these questions. And if the answer is yes, this is really what I want, then it's okay to try again. Everyone's path is different. The best thing to remember here is your resiliency and being able to bounce back when the unexpected happens. Okay, and next slide.
Fantastic. Thank you both for your wealth of knowledge in regards to interviewing skills and giving our students some tips and tricks. Before we move on to the Q&A session, I do want to remind you about some key save the dates. We are having some Pharmacist CE webinars that are approaching. I'll let you review those. So if you talk to your colleagues and some of your mentors, maybe you could direct them to those. We also have a few student webinars that are coming up. We do have one Friday, April 23rd, as well as September 15th and December 15th. So make sure to put those on your calendar, and I hope you're there with us on those dates. So we're going to move on to the Q&A session. And so during that time, I do want to open it up to all of you who are on this call today, because I really want you guys to tell us what you need to work on, or those burning questions that you're maybe afraid to ask about how to improve on during an interview. Before I get to that, I didn't want to take up too much time in the beginning, because I wanted to make sure that Dr. Medina and Dr. Cortez had enough time to go through their presentation. But I do want to touch on kind of my journey and how I got to where I am today. I went to pharmacy school at USC School of Pharmacy. I won't tell you when, because then that'll give away my age. But I did do 2 years of residency. 1 year of PGY1 acute care residency at Huntington Hospital in Pasadena, California. I also did a 2nd year specializing in emergency medicine at Huntington Hospital. I stayed at Huntington Hospital for many years as an ER pharmacist. I loved every moment of it. Transitioned into management, which is not the greatest, but very rewarding in a different way from emergency medicine. But with that, I've really grown to be able to look at individuals as we're interviewing them and be able to pick out those key things about a person. You really can tell a lot about an individual during an interview in a very small snapshot of time. So that could be in 10 minutes. It could be the way you word something. It could be your posture. It could be if you're smiling or not, the way you're dressed. We get a lot of information very quickly from you. After Huntington Hospital, I transitioned over to City of Hope National Medical Center in Duarte, California, where I oversee our ambulatory and infusion centers for all of our cancer patients. So that's a little snapshot of me. Like I said before, I've interviewed hundreds of people from a variety of spectrum that you could think of. So we're gonna head right into this chat and see what kinds of questions we have. Our first one is, what kinds of questions should be asked at the end of your interview in order to differentiate yourself from other applicants and or leave a lasting impression? Very good question. Either of our speakers interested?
Well, if you hadn't asked already, if the position is a new position or is it a vacant position, it will let you know what next questions to ask after that. So that first question, like, is it new or is this a new position, or am I basically replacing someone? Once you get the answer, of course, they're going to elaborate on the answer. Then after that, you could follow up with another question saying like, well, what are your goals? What do you envision for this new position, if it's the new position? And if it's a vacant position, you can ask, well, how long has it been vacant for? And then you can ask, what opportunities do you see for this potential position? And then sometimes being a little bit bold and asking, what do you envision this ideal candidate of yours to have? It's kind of asking them for them to give you a response and what they want. And then you can be bold. And if you're really interested and be like, I can do it. Like, this is me. I've done this and this. I'm very interested. So that question can lead, depending on what question you ask, can lead to multiple questions.
Yes, I totally agree. I think those questions were the ones I'm thinking back on most of my interviews, and that's really how I would end it. And yeah, there's nothing I would not want to add. It's perfect.
Thank you.
Great, that's really great. Yeah, I will say in some of the interviews that I've done, some of the best ones are the ones who wrap it up at the very end with a thank you for the interview and kind of a last minute pitch as to why we should pick them. So why are you the best candidate? What sets you apart? It doesn't have to be a lengthy explanation, but a very last pitch of pick me. I'm really great and I'm really interested in this position. Okay, next question. What should you do if you have no idea how to answer an interviewer's question? If you get stumped, what do you do?
Oh man, this happened to me. First, I would ask them to repeat the question again, just to make sure that I didn't I maybe missed something in the first time. After that, if I still don't know what to say, then I'm just honest. I think they can tell when you're making up answers. So I'm just honest. Like, I don't know how to answer this for you, but let me get back to you, and then make sure to get back after the interview with that answer that you didn't know how to answer.
Yeah, I agree. Definitely ask them to repeat it again. Maybe you missed something and maybe it'll trigger a memory. And definitely, yeah, if you don't know the answer to it, it's okay. I mean, you're nervous. I mean, who isn't going to be nervous if you're being interviewed and you really want this job or really want this residency? It's okay to say, can we come back to it? And then write it down, but definitely come back to it.
I'm going to take this from a residency interview perspective, or if they're asking you a clinical question that you don't know. At that point, yes, just as previously stated, ask them to repeat the question, but many times they're asking you this question not because they expect you to know it, but more expecting, or they want to see how you think, what your thought process is, and are you going to overstep your boundaries? And are you going to say something where it's not the right answer, or they could tell it's not the right answer, but you're guessing. So that's what they're trying to feel from you. So don't be hard on yourself if you leave that interview and say, wow, I couldn't answer their clinical questions. That's okay. They're not really looking for the final answer. They're just looking to see, how are you going to process this information? And are you going to be a liability to us as an employee, where you're not going to be able to say, hold on, let me look that up and get back to you. That's always the safe answer in a clinical scenario, to be able to say, I don't really know, but I know my boundaries and I don't want to harm anyone. So I'm going to look it up and I'll get back to you. But make sure you circle back with them and get back to them. Okay, one other one. As an interviewee, how much time should we use to answer each question? I'm often not sure if I should provide a brief 1-minute response in order to address all the interviewer's questions, or if I should provide a longer response, like a few minutes, but I wouldn't be able to get through all the questions.
I think you need to be complete. If you give a generic answer, everybody can look up and give the generic jargon answer. Like, I'm here for patient care and patient advocacy and patient safety, you know, like, yes, those are the buzzwords, but I want you to show me those buzzwords and show me the example. So, I don't know, from being on the other spectrum, like interviewing someone, I appreciate the examples versus like sometimes the jargon, like, yes, preface it with the jargon, but don't leave it just as a broad statement. I always recommend backing it up, because use your CV. That's why I say you know your CV, because you have a lot of examples. So that goes with, you have to prepare before the interview too. Right now you're in school, you've gone through so many things. You're going to go through a lot of experiences on rotation. But if you don't write those, if you don't keep your CV current, then yeah, you're going to forget those particular examples that can help you during an interview.
Yes, I totally agree with all that. And then I don't see this as like, oh, I have to answer this in like in a minute or 5 or a couple seconds. It really depends on the question too. Some questions you might need to expand a little bit more just to get your point across, and some might be really simple and it just takes a little bit. So practice will kind of help you identify those questions where you know you need to spend a little bit more time, and where you can just get by with just like yes or no response.
Right. Yes, agreed. And then also gauge your audience. If you start to see them kind of like turning around and typing, if it's a virtual thing, if you start to see that you're losing their engagement, then maybe you need to wrap it up and pull it together, make a more succinct kind of response. All righty. Next question. What is the best way to answer? Tell me about yourself.
Well,
Oh, yeah, go ahead. Go ahead.
well, how would you can record yourself, as I mentioned, like listen to what you're saying back, but be true. Be yourself, who you are. If there's particular assignments that you're very proud of, you feel very accomplished, then make sure you mention it. I think during my last interview, I also talked about our Spanish translation in our electronic medical record was incorrect. Some of the things that were loaded in. And I took initiative to start that project, and I highlighted it, you know. It doesn't have to be something lengthy, but yeah, just talk about your current experience, and just be truthful, like who you are. I mean, there's no right or wrong answer to that question. Tell me about yourself, but I think it's more like, do you have that answer solidified? Can you tell me about yourself in a snapshot? Basically, there's no right or wrong, but can you give me the most that you can in a concise, effective manner?
Yeah, I see. Yeah, that's so true. I see the tell me about yourself question more like your elevator speech. So if that was basically my elevator speech, to tell me about yourself. And I kind of like this question a lot because this was like the time on the interview where I can just like talk about things. Maybe if I didn't mention in my CV and it's something unique that I wanted to mention, and I would use this question to do that. But just think about it as like your elevator speech. I think that's a good way to put it.
Yeah, and I would say to add to that, and I'm going to be completely honest, being someone who interviews, numerous people at one time, during residency time, we go through probably 40 interviews within 2 weeks. So keep in mind that the person who is reviewing your CV has probably not had enough time to go through the entire thing and to read it in detail. They likely just got it on their desk, they flipped through it, highlighted a few things that they wanted to ask you, and that's all they know. So that tell me about yourself is really a good snapshot to highlight those things that you are proud of and what has got you to the position that you're at right now and got you to the interview. So the elevator speech, talking about what you're proud of, you know, make sure you practice. Figure out what are those key things and write it down. These are the 4 things I want to get across in my opening. And if you have those down, it'll be a very smooth opening for you and it won't be such a daunting task. Alrighty, that was fantastic. So I'll ask another question, one that actually is a little bit scary for me because I'm being completely honest with you guys. How important is networking for job opportunities and how did you network? I could start off with that because since I said I was being honest, I will tell you when I was in pharmacy school, I did not like it. And I thought, you know, I'll do as little as possible. However, I will tell you that networking is very important. It will follow you throughout your career. You will be networking for the rest of your life. As people say, pharmacy is a small world. It definitely is a small world. So that's why I say you will always be networking. As a pharmacy student, I didn't like to network. I didn't want to do it, but I knew I had to. So if you are a student that's like me, who would rather just go and do what I need to do, talk to the person I need to talk to and leave, then here's what I did is I challenged myself every single time I was in an event. So whether that was a conference or a webinar like this, or something different where I challenged myself, okay, I'm going to open myself up this one time. This is my one challenge for the night. And so that's what I would do, just to kind of, you know, baby steps to open myself up. And so that's how my networking started to grow. Every position that I've had has to go back to networking and those connections that I've made with people. So that is building from an intern to my residency, my PGY1, PGY2, getting into my management position was all because of networking. Transitioning to City of Hope was all because of networking. In between that, which I haven't shared with you, I've held numerous per diem positions, and all of those positions, all through networking. Okay, let's see, what does a typical interview usually consist of, and how long does it usually last?
It depends on your site. Really, the length. I've interviewed and it's been maybe like an hour, and then other interviews, like the one I just went through, I interviewed with like 20 plus people, and it was one day was a half a day, and then it spilled over to the next day. So it's very fluid. There's no length of an interview. As I had mentioned earlier, yeah, you could be applying for a staff position in 2 hospitals, okay, or 2 different ambulatory care clinics. One of them perhaps will interview you for like about an hour or 2 hours, and the other one may interview you for longer. It doesn't, every institution has their own agenda and own human resources, different policies and procedures that they need to go through. So there's no necessarily right length for an interview.
Yeah, I would have to agree with that. I would say even one of my interviews for this management position was 10 minutes long. So you just don't know. You don't know what to expect. I had 2 others after that, but you just don't know. Okay, what types of questions are asked during the residency interviews? Dr. Medina, do you want to touch on that since you just went through one?
Yes, it's a variety of questions. You have like the tell me about yourself questions, the ones to get to know you questions that you mainly will read on the websites. You have some of those. Then you have the clinical portion where you either go over a case or you make a presentation and you'll get questions asked about that. It really depends on the program and how they make their interview styles. My favorite ones were like the ones that were out of the blue. I remember I was asked if I was stranded on an island and I can only bring 2 drugs with me, which ones I would bring. I really didn't prepare for those, so that one took me a little bit out of whack. But I enjoyed it at the end because it allowed me to like quick think on my feet and like which ones are my favorite ones. And I ended up choosing Victoza for one of them because I was like, okay, I don't want to be very hungry, and I know Victoza, that's one of the uses for that benefits for it. So I was like, okay, I'll bring Victoza with me. And then the other one, I was like, Tylenol, because I see myself, I'm going to be working very hard to try to like find shelter or make my way out of the island. So then I'm going to need some muscle pain relief at the end of the day. So I enjoyed those questions a lot. And you also have group style questions. I had one where I was with 4 other candidates. We were given a scenario and we had to work together to solve that scenario. So you can have many different types of questions. It really varies, and that's where practice is very important.
Yes, definitely agreed. I will also say that the residency interview questions will change. I would say the flavor of them changes based off of the residency program type that you're interviewing for. If it's going to be ambulatory care, then study for the clinical portion, the bread and butter things for ambulatory care patients. Your diabetes management, your cardiovascular drugs, things like that, things that would be the basics, and kind of group it together. If you're interviewing for an acute care pharmacy residency, then think about the bread and butter stuff for acute care, stroke, that kind of thing, the things that you're going to have to look at for an acute care type of patient. And it'll help you to kind of manage that time a little bit better and bring your stress level a little bit down, because initially you're like, what do I study for? They could ask me anything out of the blue. So if you just break it down in that manner, it might help you a little bit. Okay, also feel free to unmute yourself if you just want to jump in and ask a question. If you are undecided about residency, at what point does it become too late to start the application process? I think that's a very good question. I think what my recommendation is to most students is just act like you are going into a residency and that's what you want, and then weed it out. It's easier to start that way instead of at the very last minute deciding that you want to do it and it's September and it's already time for you to get your documents in, try and figure out what places you're going to apply to, and narrowing down what exactly you want to do and where you want to be. So it'll be a lot of work on your end if you start very late in the process. But I'm not going to discourage you from doing that if you are in that position, because I've had many friends who have matched who were in that position. So it can be done. I would just say it wouldn't be my best recommendation to do that.
Yeah, I couldn't agree more. If you just prepare like you're going to do a residency. And then that's what I did. Actually, I decided my P4 year right in November, where I was like, okay, I'm done. But I had, throughout all of pharmacy school and through all the electives that I had taken, I was thinking I was going to do a residency, and then I decided not to. But I think it's easier doing it that way, because also you network along the way throughout pharmacy school, and also the conversations that you may have here with your mentors or your preceptors, letters of recommendation, it keeps the door open for those particular cases. So definitely keep the doors open. Don't close them in on yourself. Don't cut yourself short.
Yeah, I totally agree. I remember going in P1 year and I was like, it took me a while to get to pharmacy school. I just want to focus. I just want to study and go home after class and do well. And then I just want to work right after pharmacy school. But one of my mentors told me exactly the same thing. Just prepare like if you were, because you never know what's going to happen down your years as you go through as a student. You might find a different career path in pharmacy that you didn't know about, and you'll fall in love with it. And you don't want to be in that situation when it's too late, even though it's possible, because I have friends who've done it too. But it can just be very stressful. And I'm so glad I listened to that. I was always, I'm a first generation student. So for me, going to pharmacy school, I was very proud of it. And I've loved my time being in the community because I'm still living my dream. My dream was always to be in the healthcare profession and being a pharmacist. So that's why I was always kind of undecided too. But it wasn't really until APPES that started, and I saw like health system administration, and I fell in love with it. And I'm glad I took that advice, because then when the time came for applications, I kind of already had a lot of the stuff already lined up for applying for it.
Right, we have time for one last question. Anyone else have anything that they would like to ask the panel? If not, I have one last one. If you're not going for a residency or interested in a residency, when do you start looking for jobs?
So sometimes the jobs find you. While you're on rotations, make sure you are on your A game, because you never know that you'll get an email later or a text message from a fellow preceptor saying, hey, there's an opening. Would you like to come on board? So I can speak to that. I've been in that scenario, and actually most recently asked one of my students if they were, if they wanted to onboard to replace my position where I was currently at. And it's crazy. It's a small world. I mean, she was my P4 on rotation, but what better interview than spending 6 weeks with that person instead of having them for just a couple of hours when they prepare. So when you're on your rotations, that could be a potential employer, and you're basically interviewing for those 6 weeks. Do you show up on time, and do you turn in your work? And then you may get an invite for a future opening.
That was really great. Thank you so much. So we are approaching the end of our webinar today. I will be putting my email information in the chat. So I welcome any of you to reach out to me if you have any last minute questions, or when the time comes, when it comes time for you to interview. I'll definitely be willing to help you in any which way that I can, and coach you through any kind of nerves, or, you know, how do I answer X, Y, and Z? Because we really want you to go into the interview process, whatever the setting is, and to be comfortable as well as prepared. Because if you're not prepared, and if you're not comfortable, and if you're nervous, it's going to show. And we want you to be able to shine during that time, even if it's a 10-minute interview, or if it's an hour, or if it's a half a day. We want you to be on your A game, because you are going to be the next individuals to help drive NHPA. You guys will be the next individuals to help change the healthcare for Hispanic populations. Okay, thank you so much for being with us today. Thank you to Dr. Medina and Dr. Cortez for all your time and effort, and as well as being with us today. Have a good evening.
Thank you so much. That's good.
Thank you.
Information.
That's good. I'm glad you got something out of it.
Thanks.